with appropriate skill match to add value to that body of work, and that each of these components is multi-sectoral. And so we thrive and try to have representatives from government, NGOs, from the academic community, from the adjacent or associated industry, from citizen action groups that may be associated with this, and representatives from media and communication. So there are many logos that you can see on here of participants in this coalition, and we are grateful and thankful to all. And I think that one of the key components of this shared leadership model has been the increase in capacity that has occurred, particularly in the academic space, and the level of academic involvement in this issue of drowning in Canada has been facilitated by the work of the technical working groups and the steering committee and the coalition as a whole.
Absolutely, Steve. And the technical working groups form multi-sectoral groups themselves. And so they have various players around this table offering a different perspective on drowning. And of course, coming together, it provides a clearer picture on what's happening here. They create recommendations for impact, and they use evidence-based and evidence-informed decision-making. And this is very important. So we want to rely on the data. We want to go out and get new data if it's not present at that time or not current. We distill, disseminate the best evidence coming forward, and that informs the action steps to reduce drowning in each of the key focus areas.
So you received recently, I think on Friday for many of you, the latest update in the Canadian Drowning Prevention Plan. And really this is a plan that was driven from the original global report on drowning in the WHO, which identified that each nation should have a drowning prevention plan. It identifies key actions that would likely have significant impact. It focuses on high-risk communities. There's benefits to stakeholders, such as the various NGOs that are involved in this issue. It has a shared leadership and capacity building model, and it needs effective implementation, and the impacts and outcomes that we are hoping for would be best achieved by broad and significant engagement by the multi-sectoral components that includes government, NGOs, industry, media, and others. So we thank everybody who inputs and works hard on the various versions and iterations of this plan, but it moves ahead pretty aggressively. So, starting tomorrow, we'll be working on the 8th edition and what are the changes and improvements that need to be made to make this more impactful.
And taking a look back at these, the last year, we've produced the 6th and 7th editions. And as Steve has mentioned, this is done pretty aggressively. And so we will be starting work on the 8th edition that is already laid out with the template. Believe it or not, it's sitting there waiting. And so we continue to move forward. But this past year, we also produced the 2019 annual report. We established Canada Helps and Benvidi profiles for donations. So this is new and came as a result of our new charitable status. And so different means of and different ways of accepting donations and ensuring that those tax receipts are received by our donors. And we are very grateful to those donors. We issued a campaign, and this was a 2-part campaign. The first focused on individual donations, and we were hoping for a total of $2,000. And for individual stakeholders, we had a goal of $40,000. Increased communications and social media presence. So not only was Facebook involved, but of course LinkedIn, Twitter, Instagram, and YouTube. We continue to build on our YouTube account because a lot of things, especially now in light of the pandemic, have been shared via video. And we find that this is a very positive action and positive move forward, and fairly simple to do now that we figured it out. And so we'll continue to move forward in that manner as well. We'll continue to build our photo library. As we move forward, there are some photos that are included in the 7th edition. Other times we'll include these in the annual reports or generally our social media profile. So if you have photos that are following all the water safety components, because that's the key, feel free to share them with the coalition. We'll add those to our photo library. Please do give credit where credit is due so that we can share that as well. We made an annual presentation to the Government of Canada and NGOs back in early June, and we registered as a lobbyist so that we can reach out to Government of Canada MPs, ministers, and make recommendations and even sit and speak with them. In terms of the summary of activities, we also are continuing to learn from the Assembly of First Nations and the Métis National Council. We are very grateful for these relationships and ongoing dialogue. We ratified a new leader and technical working group for young adult males this past summer. We planned Symposium 2020 entitled Eliminating Drownings in Supervised Settings. And although the pandemic changed the method of delivery to distribute the information, we will be continuing to distribute that information via the website, so it will be free. And these will roll out over the course of the remaining fall month. So we're just awaiting a response to a letter of interest sent to the Public Health Agency of Canada back in September 2019. I think it's fair to say that PHAC has been fairly busy over the last 7+ months, and they'll continue to be. This project is simply on pause right now, so it has not been canceled, and we have been in touch. So we'll continue to monitor their progress and continue to touch base as time moves on. We submitted a grant application to Transport Canada's Boating Safety Contribution Program, focusing on the creation of an online interactive map which features recreational boating incidents. And so when we talk about boating incidents and boating events, we're talking about both fatal and non-fatal, and we're going to need to change the conversation because in the past when we've talked about drownings, we focused more on fatal. So we need to bring non-fatal into that conversation. Created a technology and website committee, a volunteer translation committee due to the pandemic, and we're grateful for these individuals. We are seeking financial support for operations and projects, and we continue dialogue with stakeholders. Those are the activity updates, Steve.
So some dialogue with key stakeholders, one being the Government of Canada. We continue to work at establishing effective relationships inside the Government of Canada and its various departments, and these are some of those departments that have participated in those dialogues. So we have an annual update webinar, which we did online this year for the first time and found that to be actually more effective than we did when we did this in person. But participants from the Government of Canada and their ministries and agencies included Indigenous Services, the Public Health Agency of Canada, who we are working hard to continue a relationship with, the Public Safety and Emergency Preparedness, Transport Canada, for which we have a grant application in currently, Transport Safety Board, individual members of Parliament, because they either have an interest in our work or they sit on a committee that we would like them to be interested in our work, and the Standing Committee of Finance, who we have made presentations to and will continue to do so.
Of course, we have ongoing dialogue with provincial governments for the BC Ministry of Health and others, dialogue with organizations that represent Indigenous peoples, as mentioned, Assembly of First Nations, Métis National Council, and of course, New Canadians.
So we're now going to move to the recommendations that were included, and these are the big overall recommendations from the 7th edition. Some of the recommendations that we've made in the past are brought forward with each additional version of the plan, and so you'll see some of these are repeat recommendations that have been made in the past, and some of them are new. We divide the recommendations into community action, policies, and legislation and research. So we'll start with the community actions. Delivering a message of uninterrupted and consistent adult supervision of children needs ongoing attention and messaging and action on a multi-level basis. the multi-layered approach to drowning prevention needs focus, meaning that you can't just have adult supervision. You have to have areas which have been identified as safe places. You have to have support equipment should there be a misadventure. You need to have CPR training in the community. That's what's meant by the multi-layered approach, and drowning prevention certainly needs that multi-layered approach. There needs to be some action and some culture change with regard to reducing drowning in supervised and unsupervised settings, including life-saving information equipment plans, protocols made to decrease these drowning events. So in the past, the culture has really been you provide lifeguards. If we think about it from a outdoor recreational perspective, you provide lifeguards at a beach or you don't provide lifeguards at a beach. We're trying to fill in some of the space in between. If you don't provide lifeguards at a place where there's swimming and drowning risk activity, then there must be other things provided, such as information about risk, such as some safety components, the least of which would be telephone communication information, some rescue equipment if that's appropriate. And so there needs to be some culture change with regard to the way we look at this component. The other piece of this is that there continues to be a rare and unusual, but drownings that occur in supervised settings. And we need to have a relook at that to see if we can use multi-layered approaches, technology, and other forces to try and make that go to zero. So if we continue to advocate that actually learning to swim and having enjoyable recreation is a strategy for drowning prevention reduction, then we need to make sure that that intervention has zero or as close to zero risk as possible. So most vulnerable Canadians need to be engaged in solution finding and leadership. So those communities such as new Canadians, Indigenous Canadians, male young adults need to be involved in the solution finding and the leadership of the interventional strategy determinations for their focus. Facilities and supporting the implementation frameworks for survival swimming for all Canadians and all new Canadians. So we are advocating that every Canadian should have survival swimming skills, and we use survival swimming in the generic sense. So basic swim skills would be probably another generic term for this, but every Canadian should have the option to have that education. And yes, there are some specific groups such as new Canadians for which programs need to be directed to them. Multi-sectoral collaboration needs increase, so diversity of inputs to conversations like the one we're having this morning, and we're trying to do that as much as we can with the steering committee, with the technical working groups and the activities that they undertake. The diversity of points of view and frames of reference are needing to be expanded. Building relationships with the stakeholders needs ongoing work, and we've been doing this to the best of our capacity with ongoing communication and relationship building with the Government of Canada, with the Assembly of First Nations, with a variety of other Indigenous Canadian associations, with multicultural associations and communities across Canada. The ongoing building of relationships elevates mutual respect, helps exchange evidence-based information, and will be critical in terms of the implementation effectiveness of drowning prevention activities in high-risk populations and communities. Canadians are encouraged to seek and identify and share drowning prevention initiatives with a focus on best practices and impacts. And again, the division that you'll see repeated in our work is community actions, policies and legislation, and research. Three important components. Canadians are encouraged to seek and identify and share drowning prevention strategies and use, and we are developing tools. So we have a framework for community coalitions. We're about to embark upon a mapping project to identify high-risk areas, but also to inform preventative actions. And so enhancing protocols for prevention will continue.
Taking a look at policy and legislation, we are recommending support for the UN Declaration on Drowning Prevention, the funding of non-fatal drowning in research in Canada, funding for the design and creation of an online map, which would identify areas in which drowning events have occurred, or more than one incident has taken place, where multiple drownings have occurred in a single situation, and where high risk areas are identified where communities and governments can take positive action to prevent future drownings. And so this can be in terms of working with the public. It could be signage, it could be increased enforcement, it could be a focusing of any number of different impact and action items. Of course, facilitating and supporting an implementation framework for consistent pool fencing legislation across Canada. Right now, we are all over the board. There are large sections of the country all over that don't have any legislation in place at all by way of pool fencing. Amending small vessel regulations to require that Transport Canada approved personal flotation device or life jackets must be worn by each person on board. It's not simply enough to have a life-saving device on board when you're in the midst of a situation where you need it. It is not easy to find them. Sometimes they are found underneath in the cabin or underneath a bench. These are not going to be easy to put on if you're already in the water, let alone easy to find, and you want to ensure that they're properly fitting. So again, difficult to do when you're stuck in this situation. So having them worn at the beginning is the safest bet. Amending regulations requiring the use of buoyant flotation devices or life jackets on commercial fishing boats. We saw this in 2019 in BC, and we hope to see a continuation of that across the country. Facilitating and supporting an implementation framework for mandatory CPR training with driver's licenses. As Steve mentioned earlier, when we have all those bits and pieces of life-saving in place, when we're in a non-supervised or unsupervised setting, this is very helpful. We need the skill set. And if everyone were to have that linked with the driver's license, and again, it's easy to take action and to save lives at that given time. Implementing a drowning review board is another recommendation that we've made over the course of the last few editions and will continue to make working in the future.
So on the research side, designing and delivering the interactive online map identifying drowning locations and circumstances in Canada is a new project that will allow us to have a more current look at what's happening in drowning incidents, and this will include both fatal and non-fatal drowning incidents. The utilization of the learning from the road traffic reduction that has occurred in Canada and many other countries around the world, where in the injury prevention arena, the piece of this that has been in existence for the longest time has been surrounding road traffic fatality reduction. And this is not just in Canada, but it has been strong in Canada. It has been well funded, or at least funded relatively more generously than other injury issues. And there's some learnings from that we can apply to the drowning prevention work that we're doing. Collaborating with drowning prevention technology industry to determine the effectiveness of this technology is an important piece. So we are seeing a blossoming of a technology emerge into the area of determining when somebody might be in trouble in the water, video systems and movement measurement systems that may be helpful in determining when action is needed. And at the moment, we're really at a phase where those things are being presented, but there is no evidence of their effectiveness. And so creating a framework to determine their effectiveness would be one of the research projects that we are promoting and participating in, to seek partnerships with technology and academic sectors to create some scholarship around creating that effectiveness of technology piece. Research on the benefits of survival swim programs for new Canadians is a piece that is in grant application currently, and research by and for Indigenous peoples it would be an important priority. continuing with research, improving our understanding of the socioeconomic risk factors that are connected and aligned with drowning is an important piece that stratifies. We know that there are communities in Canada that are at higher risk than others. And is this purely socioeconomic, or are there other issues? And what are those socioeconomic issues? And how can we utilize that information to focus prevention programs more effectively? Research on the effectiveness of the swim testing. So many jurisdictions in Canada use a swim test for the determination about whether a child or a younger person, usually, but not only younger people, it can also involve adults, whether they have suitable skills to go into certain aspects of a swimming pool or a waterfront setting that might have somewhat higher risk. And there is little or no evidence on the effectiveness of that swim testing approach for this determination. Research, of course, on alcohol-related drownings and their impact, and specifically on how various programs around the world have tried to attack that and address that issue, and where they have been more success and where there's been less success, so that we can have high-value educational and behavioral change programs. Collection and inclusion of non-fatal drowning in nearly everything we're doing. So we really want to move away from just focusing on fatal drownings, and we really want to incorporate non-fatal drowning into our data collection, into our assessment of risk, into our planning for interventions. And this, although is easy to say, is actually quite challenging to do. And so there is some global effort as well as some Canadian effort in trying to clarify what a non-fatal drowning is, what is the classification for those, and how we can actually access and collect that data and then utilize it to inform prevention. Greater depth of inquiry by coroners and medical examiners in key areas related to drowning. So we are continuing some ongoing relationships with coroners and coroner services and the National Coroners Association around improving the interaction between the advocates for drowning prevention and the coroner and medical examination or examination process. The inclusion of intentional drownings into the drowning data and into, where possible, the preventative action. So this is a very uncomfortable area for many of us. I'd say all of us, but it is part of the drowning issue, and there are drownings that occur as a result of people's own decisions, and we need to start incorporating that information into the overall number of drownings that occur in a nation and in a region at any one time, and B, where are there windows for prevention with that intentional drowning cohort. Improving consistency of data collection and analysis of drowning. We can always make improvements in this area to reduce the uncertainty in the data and in the analysis of that data. And so we continue to work with our international partners and our partners within Canada to improve the data collection and analysis of drowning work, and research focused on bystander and rescuer drowning. So not just in Canada, but in most countries of the world, this is a significant issue. Somebody gets into distress in a water scenario, and a trained or untrained bystander responds to that, and often there's now more than one person involved in a tragic incident, and we need more understanding and more approaches to educate and intervene in a way that doesn't place additional folks and community members at risk. So the third and final piece of the research list, which I realize is long, but normative guidance from the WHO on unintentional water entry definition and clarification is a piece of work that is ongoing now. Drowning in supervised setting as a national priority, moving that down to zero. What are the cultural changes that we need to do to undertake that? How do we integrate technology into that? How do we have evidence that that technology is being implemented? Because of the effectiveness of the technology versus the cost or the appeal of the technology. Retrospective and prospective studies linking neurodevelopmental disorders and medical conditions. So we know that children and younger people with neurodevelopmental disorders have a higher burden in drowning fatalities, not just in Canada but elsewhere, and also young and older people with medical conditions are disproportionately represented in drowning mortality, and we need to understand that better, both from a retrospective and prospective perspective. The reclassification of drownings resulting from motor vehicle collisions. So for the most part, drownings that occur related to transport are excluded from traditional data sets with regard to drowning. I think we need to have a better understanding of that issue and how many of those are, and when there's 3 people in a vehicle that submerges in some way, the mechanism of death for most of them will be drowning. It won't be classified as drowning. So a better understanding and utilization of that data and what can be learned from that from a preventative point of view is needed.
Now on to the 2020 Drowning Prevention Award, Stephen. And before we move on to announce the recipients, I want to take a moment just to thank our subcommittee. Each year, we reach out to our steering committee and we ask for volunteers to step forward and review all the nominations and applications that come in. This year is no different. So a big thank you to this committee for doing all the great work and coming up and making these very difficult decisions. There were wonderful applications that came in this year. So keep going, keep working hard across the country, and keep sharing what it is that you're doing, your initiatives, your actions, your new coalitions. If you're planning to form something, let us know what's happening out there. It gives us a better understanding of where there may be gaps that need to be filled. It gives us an understanding of the great work that's happening, and perhaps we can support you or link you in via network or provide support via social media for you as well. All right, so 2020 Drowning Prevention Award recipients are the 2019 Award Community Action. Recipient of the Community Action Award is University of New Brunswick International Swim Program for its targeted, innovative, and impactful program focused on teaching survival swimming skills to new Canadians, both adults and children. Congratulations, UNBISP. For the 2020 Award for Research, the recipient of the Research Award is the Community Against Preventable Injuries for its project to develop, deliver, and evaluate a social media campaign for recreational boaters to raise awareness, transform attitudes with a goal of changing behavior and reducing boating injuries in BC. Well done. There is a YouTube connection there, so if you decide to review this recording later on, you can certainly take a look at that and look up to see what it is that they are doing there. So congratulations. And this year, Steve, I'll pass this over to you because this is the first year for this award.
So Barb McLintock was one of the steering committee members, and she is a retired coroner, was a retired coroner, a retired media personality in British Columbia, and she unfortunately passed away unexpectedly from medical complications, and she had some strong, interesting conversations with us, and we wanted to carry forward her message in a bit of a legacy, as did her family and community supporters. And so the Barb McLintock Memorial Communication Award was created to acknowledge that to be effective communicators of drowning prevention strategies, we need to communicate in a way that's not dependent on a specific language or culture. And so using infographics and using communication tools that are not culturally dependent, they're not educationally dependent, so they can be understood by people from any language, any culture, any background is what's needed to have more effective messaging. And so this award was created to annually acknowledge an organization or a place where this kind of approach to messaging has been championed or undertaken. So the recipient this year is the Life Saving Society Canada for their drowning prevention report infographics, which are easily exportable to community programs. And so the use of these infographics will be very helpful at the community level and should start to appear in communication pieces that would help people understand the drowning issue and how to prevent it, and are minimally or not dependent on the culture background of the individual who's reading them or seeing them, whether they have a high level of education or not, whether they can understand English or not. And so this effort has been substantial in terms of transforming the data from the drowning prevention reports, or the drowning reports in both nationally and provincially. These infographics have been extensively used, and we wanted to acknowledge how helpful they were and encourage their exportation to other documents used by communities across Canada.
In summary, we've covered a lot of ground today. Thank you very much for listening. We'll go to Q&A in a moment. And before we do that, we'll just take a quick review. We've looked at the background of the coalition. We've talked about shared leadership and capacity building, and you can certainly see from the list of activities that have taken place and the recommendations moving forward, there's a great deal of capacity there. Canadian Drowning Prevention Plan, the 7th edition, and onward with the 8th edition. If you have yet to be involved in those editions, feel free to reach out to the office anytime. We'd love to have you on board. Summary of activities. We've recovered the dialogue with key stakeholders. Recommendations, which included community, policy, legislation, and research, and of course, are recipients of the Drowning Prevention Award. So congratulations to you all once again. Steve, I think we'll switch to question and answer, and we'll bring Adrian back on board. Thank you, Adrian, for collecting these questions.
Well, I think you guys covered a lot of ground there. So we don't have any questions come in just yet, but I guess we'll give it a moment just in case anybody wants to type it into the chat now. Or, you know what, maybe you've covered everything.
If we're needing to fill some space here, one of the pieces that I want to both thank all the people on this call and the various people behind all of this work, and particularly Lisa, who is the project manager, is that the work of the coalition has been designed from its beginning to align, collaborate, and add value to the great work that's done by the participants of the coalition. So there's been, for decades and many decades in many cases, great work that's been done in drowning prevention by many of the participants of this stakeholder group. And so the coalition is really looking for ways, and I think we have found several ways actually, where we can enhance and add value to the work that has been done by the many partnership stakeholder participants in the coalition. So just wanted to make that point again, that the work that we're doing is not meant to overshadow or discourage in any way the work that participants have been doing for decades and decades in this country. It is the coalition's work is really designed to add value to all of that.
Thanks, Steve. Well, you know what? Lisa, I have a question. For one, first I'll make a statement. I'd like to encourage everybody to download a copy of the 7th edition of the Canadian Drowning Prevention Plan. Lisa, where's the best place for, oh, you're beating me to it. Where's the best place for people to find that?
Well, you can always find the latest edition of the plan on cdpcoalition.ca. We're also trying to track how many people are accessing this and downloading the plan. And so this is why we've created a shortcut. A big special thank you to our webmaster for doing that. And so you'll see these bit.ly / numbers, letters following that. So you can find those using this, or again, you can just simply go through the website and access at any time. It is free to download in both English and French. And feel free, and please do share it with your networks. So bring it up on your website if you wish to have a logo of the coalition to assign to that, or a photo of that cover photo. Let me know. I'm happy to share that with you. And the same holds true in terms of your social media. Share it. The more we share the information, the more apt it is to get in the hands of those who need it most, and we can save lives along the way.
I'm glad you mentioned those social media platforms. I can see at the bottom we've got Facebook, LinkedIn, Twitter, Instagram, and YouTube. What are those handles? How can we find you?
Well, actually, if you, I believe it is CDP Coalition. It's just as simple. We've tried to keep it as simple as possible going through. I believe you can also run a search on Canadian Drowning Prevention Coalition, and it should come up. If you still can't find us, send me a note at the office, info@cdpcoalition.ca, and you'll find it right on the bottom of my signature, and there's links attached to each and every one, so it's easy to find.
Okay, well, you know what? It doesn't look like we've got any questions. So I just would like to thank everybody who attended today. And thank you, Lisa and Steve, for the great presentation, and and for all the work that you've been doing this year. Looks like we've had a lot done. Once again, I'd like to encourage everybody to download a copy of the 7th edition of the Canadian Drowning Prevention Plan. And that's it. So thanks, everybody.
Thanks, Adrian.
Thank you, Adrian.
Thanks, Steve.
Take care, everyone, and feel free to reach out at any time.